So does it hurt you when I put, yeah, it does? It does, okay, let me put a little numbing. See, that one wants to ooze a little bit. I'm gonna put a little numbing on this other one here. Baby pinch here, okay? Baby pinch. I think you have either acne, keloidalis, NUCHAE, or something called dissecting cellulitis, but I'm more on the acne, keloidalis, NUCHAE kind of category. AKN, we call it for short. And this is not something that I can, there's not a great treatment for it, unfortunately, like to treat the cause of it. Unfortunately, other than if you try to really keep your, my advice to you, if you try to keep your hair longer here, the back, you got to bring back the days of Coming to America, you know, the guy with the long hair, the Jerry curl guy. You got to bring that back. I'm going to push on that lightly. See, they want to ooze under there. It's like a little, does that hurt a lot?
No, I don't feel it.
Okay. It's like a little abscess, really, like a little inflamed, like a pimple that gets, like hair that gets trapped under here is usually what causes it. So let me just make I put numbing right here. Let me make a nick over to this one here. And we'll try to squeeze that out a little bit, because it helps to relieve the pressure there a little bit. Oop, that was my stomach. Can make that noise. So hopefully we can, and like you've been doing, warm compresses are helpful, and we're going to give you an antibiotic, a topical antibiotic, clindamycin gel, and we're also going to give you an oral antibiotic to see if that helps you when you get the inflammations. But the first, most important thing is to keep your hair growing a little longer.
Okay.
I mean, like that, there's a little extraction. It just depends, because I think technically an esthetician, at least in the state of California, can't pierce the skin, so they cannot be as aggressive as maybe, you know. That's all. So you can't necessarily do as many things. I'm sorry. Oh, I'm sorry. That was pinchy.
Okay. It's okay.
Let's take this bigger one out here. I thought I numbed you, but I guess I didn't so much, huh?
I was getting so desperate about this. I was thinking of
What were you gonna do?
taking my X-Acto knife and poking
Well, I
it
guess
right
I did
in the-
myself a little bit, but at least I used a little numb in there for you.
Yeah, then that's what I started thinking about. That would hurt, wouldn't it?
Yeah, and then you have a little blackhead back here. I'm just gonna lift your skin up, give you a little pinch.
Thank you.
There you go. And then push on that one out.
What would a day of extractions cost?
Oh, I think it would cost a lot of money, actually. If we just make a nick in the skin, we can do this one. It's a very superficial pinch. I'm sorry. I mean, but you asked for it, Missy.
Actually, I didn't ask for this one.
Oh, you want me to stop?
No,
I know you don't, because I know you feel all these stuff on your face, and you always come
I
in.
do, but then I actually
regret it while you're doing it. This one right here, I'm gonna make a little nick in the skin. These are MILIA, and I already numbed this. This one here too. Pinch here. Pressure, pressure. There we go. Oh, that doesn't want to come out without a little fight. Let me just work on this one here first. There we go. That one came out. This one right here wants to stay as long as it can. They're like almost like a little pearl under there. So it usually wants to come out whole, but you gotta make a big enough little nick in the skin so it will. There we go. Good. Okay, it's really common to get these around the mouth, especially the sides. I put some numbing right there, but they're under there. So I go in the direction of our regular little skin folds here. Push against you. There we go. One, two. This one, I want to just make sure I got it all. It's so hard to push against you. I don't know. I'm not convinced. Oh, your tongue is not strong enough to push against.
Well, I'm just trying to
Thank you
help.
for helping me, though. This is Candida antigen. This is not as commonly used. Okay, one little baby pinch here, very superficial into the wart. Pinch here again. It's supposed to hopefully kind of trigger an immune reaction here. Your body to kind of get angry at this area, and then hopefully it goes, wait a minute, there's a wart here. Let's get rid of this. So I'm going to try to inject them very superficially. She's tough. I'm going to do one over here. Okay, one little pinch. Really superficial where this flat wart is. And I'll do one more back here. You were so good. That was easy. You're tough. Thank you for letting us do it. Let's see how the reaction goes. Sometimes it's hard when you numb it to localize where it is, so I'm going to just pinch you a little bit here. Not hurting you, right?
Yeah.
All right, let me see. Oh, I think there's something is dark under there, maybe. I do think there might be something under there. There's something gray under there. What did you get? Did you grow a diamond?
I don't think
Perhaps.
so.
Oh, ooh, look at that.
What is it?
It popped out. I don't know. Do you want to keep it?
No, I knew there. Looks
Yeah,
like
you were right. It
part of
popped
a
right out.
thorn.
Yeah, I think it is. How long was it there for? It was just
Probably-
getting a free ride.
Yeah.
Thank goodness it wasn't a seed and it didn't grow. You didn't even know you had this. You have a little diamond, your own little diamond here in your ear instead of your ear piercing.
Yeah. I don't wear earrings very much anymore, so
I guess if you did, you probably would have noticed,
noticed it
sooner.
more. Yeah.
See, take a look at that. Open your eyes from right. You see this?
Oh, that was a little clump there.